If you get a pancreatitis, it hurts the whole body. If you get a headache, it hurts the whole body. If you get, diabetes, it hurts the whole body. This earth is one body, even though we're living in different parts.
This Stanford African Scholars program, it's just unique. It particularly puts your partner on equal footing, both here in the States and overseas.
SASH was founded by Dr. Michelle Berry and launched in 2023 in partnership with Pfizer. Through this program, we are bringing 24 African physicians to Stanford in 2025. Each scholar or African physician is paired with a Stanford faculty mentor in their area of expertise. Each physician has identified a skill set they are hoping to gain with support from their mentors and through introductions to other experts in the field.
3 things stood out to me. Focus on health equity. The second one was bidirectional collaboration. And the third thing is capacity building.
I am passionate about global health because of the partners and the friends that I've created in Alamayo. He helps keep me motivated and interested and passionate about global health.
For many years, I've sent U.S. scholars overseas to many parts of Africa particularly. And we never ever had the funding to actually have that equitable, collaborative partnership. This was an amazing grant, which lets me actually bring scholars from Africa to Stanford. And this was quite hard to do, actually get them appointed at Stanford as instructors so that they could also teach while we also taught, so that it was a true collaboration.
What is unique to SASH is the sustainable nature of the program and the fact that it's locally led. This starts with recruitment when scholars identify the skill set that they want to obtain while at Stanford, to the development of their proposals, which is locally contextual and really informed by each scholar's expertise and what they're seeing on the ground in their daily work.
I'm hoping that by the end of my SASH project year, we will make a difference in terms of newborn mortality rates, that we would have increased capacity of faculty and staff, that we will have frontline staff who are well trained, and that overall there'll be a better culture of safety and quality improvement in it.
See that we can set heart rate, oxygen saturation, respiratory rate. Being a SASH mentor has been really inspiring, really eye-opening to hear from you kind of what are the challenges, what are your visions, what are your goals for your own institutions. I hear a lot about conducting neonatal resuscitation and clinical research to try to improve neonatal resuscitation in low and middle income countries, but I actually don't personally have my own sort of direct experience or knowledge of what it's like, and so actually learning from you about what is the construct of your hospitals and how do clinicians come to be in these situations and what preparation they do or don't have has really helped me actually have a broader understanding for some of the work that I even do outside of simulation.
The format that exists out there is mainly people from this side, high-income countries going to work in Africa, but it's the opportunity for people from low-resource settings are limited.
We've also had to be very innovative and resilient and to learn to do more with less.
I am originally from Africa, and I have an intimate relationship with that continent, as well as I have deep knowledge of the healthcare deficit and challenges. While Stanford can provide technology and knowledge and distribution, there is an opportunity to learn from leaders coming from middle or low income healthcare system. These are leaders who work with the community, as well as they learn to use their limited resources to be innovative and to deliver care under lots of constraint. Looking at the direction of healthcare in this US, I think there is a lot we can learn from them in terms of how to build sustainable healthcare delivery system under strict and limited financial resources.
The most fulfilling has actually been the personal relationships. The work is fantastic. They're doing great work, particularly around antimicrobial resistance, pediatric sepsis, absolutely fabulous work, but it's really about the relationships.
So much of it is how you frame a partnership or how you frame a collaboration. It's not about us necessarily mentoring, but we're all partners for our African scholars.
When one is unsafe, no one else is safe. So it goes beyond just treating disease. It's a security issue, it's a hope issue. So in that kind of uncertainty world where we live today, there's such a shining light of what Stanford is doing as collaborations between the global north and the global south.
I hope that this is a symbol of investing in people, investing in relationships. Global health is not a race, it's a marathon, and it's really about helping others and empowering others through friendships, through understanding where people are coming from, and that doesn't happen overnight. It happens over injera, coffee.
We think our collaboration can help or motivate others to have long-lasting, effective, and meaningful collaboration. I think there is a beginning of a new chapter. Yeah, thank you.
Yeah.